could increase in Australia. The substances have already found their way into Australia's illicit drug supply. There have been alerts to their presence in drugs like cocaine and ketamine, and police in Victoria detected synthetic opioids in the bodies of 4 people found dead in Melbourne last month. Sione Crawford is the CEO of Harm Reduction Victoria, an organisation for people who use drugs, and he joins me now. Sione, thanks so much for making time for us.
Hello, thank you, Melissa.
What makes synthetic opioids so dangerous?
Look, there are a number of things that play into that. One is that nitazines and fentanyl are orders of magnitude stronger than morphine and heroin and oxycodone and the sort of opioids that are more common on the market. So in the case of nitazines, they can be up to 1,000 times or 2,000 times as strong, and there are multiple versions of it. So if that accidentally or intentionally gets into a drug supply, it can lead to overdose really, really quickly. And sometimes that can come on much more quickly than a sort of a more traditional heroin overdose as well.
Places like the United States have seen a surge in overdoses. Why is that? And are there concerns that Australia is heading in that direction?
Look, we are in a different situation to North America, but what's happened over there is literally an epidemic where tens of thousands of people each year pass away from overdose, and we really want to make sure that we avoid that. We have some warning because that's happening there. Nitazines in particular are getting into the market in the United Kingdom and Ireland, and we've seen that the impact can be really fast and fast moving, and we just want to make sure that we talk about this, raise some awareness, and we put in place some plans before this hits our shores. And if it never does, that's great, but at least we're prepared.
You talked about how small doses can have such a huge impact. Just how common is it to find, I guess, the more common drugs cut with these sorts of synthetic opioids?
Well, that's one of the concerns, is that over the past few years, this has been found multiple times in drugs, as you mentioned, like cocaine, ketamine, MDMA, and others over the past few years. And a number of people have already passed away, as you already mentioned. And so what we're seeing is what seem to be isolated incidents seem to be happening at an increasing pace. And so isolated incidents start looking like a pattern. And, as it's an unregulated market and we've got very little vision into how it works, we are preparing for the worst, so to speak. And that's why we're talking about it today.
So Harm Reduction Victoria and the Alcohol and Drug Association have developed a Potent Synthetic Opioids Plan. You've presented that to the government. Tell me about that plan. What's in it?
Sure. So number one, it's about putting together a coordinated multidisciplinary task force, which, sounds like a lot of jargon, but basically it's getting a bunch of people who care about this and know about it together in one place to make sure that if this kicks off, we've got a structure in place with government support that can respond really quickly. And then it's also about pre-positioning some health resources. So things like making sure that we've got adequate supply of naloxone, which is a drug that reverses opioid overdoses, making sure that we do this sort of awareness raising, because a lot of people don't know what an opioid overdose looks like. So, we're encouraging people to understand how to recognize an opioid overdose, but also ensure that things like the drug checking service, which the Victorian government recently announced as a trial coming up, which is fantastic news, that is linked in as an early warning system, and that we have a communications plan as well to share that widely with the community. In Ireland, when this took off, an example of how they, pulled out all the stops was actually putting warnings up on some of those roadside signs, the digital signs that tell you about roadworks and whatnot. So we're really think outside the box. How can we get in touch with as many people as possible and be as prepared as possible? Because what we know is that the emergency services and the emergency departments and the hospitals will bear the brunt of this if we're not prepared, and that will be far more costly and potentially lead to more deaths than are necessary as well.
You've presented this plan to the government, so what's the response been so far?
Well, we've got a good relationship with the Victorian government in the sense that, I think that they are committed to ensuring that harm reduction is something that doesn't jump off the table. They've announced drug checking, they've announced naloxone vending machines, and they have an early warning system as well, and they've announced a drug strategy. And our ask really is to try and bring all of those things together and add a few bits and pieces to it. So we're really happy to work with the Victorian government, and so far their response has been really positive.
Sione Crawford from Harm Reduction Victoria there. Thank you so much for your time.
A pleasure. Thank you.
We may be more connected to friends